Some symptoms of early pregnancy are also very similar to symptoms that you'll have when you're about to get a period. The main ones that come to mind are cramping, spotting, mood swings, and breast tenderness. These can be very difficult to differentiate if you're about to get a period or starting a period, or if you're early pregnant. So let's start with the cramping. Cramping is something that we all expect when a period's coming on, right? We know that the uterus is about to start contracting, period's about to start, but cramping is also very normal in an early pregnancy. Some people get concerned if they feel cramping. This is something that people will call the office for quite a bit, and sometimes even go to emergency room to be looked at because they're concerned if they know they're pregnant and they're feeling cramping. And of course, if you're concerned, you can always call or get this checked out. A lot of the time though, cramping is normal, especially if there's no bleeding associated, because this is the uterus starting to stretch to accommodate the growing pregnancy. Now, spotting and bleeding can be a little bit more difficult because if we've had a positive pregnancy test and we do see spotting or bleeding, this is usually a little bit concerning because in general, there shouldn't be any bleeding in pregnancy. However, a lot of times a little bit of spotting or light bleeding, especially in early pregnancy, can be normal. So this can be something like implantation bleeding, which happens in about 1/3 of pregnant females. And that's when, as the embryo implants into the wall of the uterus, a little bit of bleeding accompanies that, and you see that in your underwear or when wiping, you'll see a small amount of bleeding. Now, this also tends to be associated with some cramping because that process can also cause some crampiness. So how to know if it's normal or if it seems like something's not right? Generally, it's based on the severity. If you're having bleeding to the extent that it looks like a normal period, or you're having very severe cramping, this would be something to try to get some attention for and have evaluated, or call your clinician. Breast tenderness. So in either situation, period coming or early pregnancy, progesterone's going up, and this causes the glands in the breast to become tender. It's often very similar whether you're pregnant or you're having a period come up, but you'll find that once pregnancy is in place, that tenderness just continues to take off as time goes by, and the breast tissue starts to increase in size and tenderness continues. Whereas when you're having a period, once the period starts and progesterone is going down, the breast tenderness will resolve. Mood swings, all due to hormones. So either way, period or with a new pregnancy, there can be some mood changes and mood swings. And this is due to that fluctuation in hormones. So how about some symptoms that are more specific just to an early pregnancy? In addition to what we already talked about, one of the more common early symptoms is fatigue, and that is some serious fatigue. You will be so tired, and this is one of those things that doesn't affect everybody, of course, but sometimes people will experience a very serious fatigue where they just feel like they don't want to do anything through the day. They've slept a lot, but they just want to keep on sleeping, but they're very, very tired. There's certainly some fatigue associated with around the time of your period for some people, but the fatigue associated with early pregnancy is usually pretty extreme. That's because your body's doing a big job. It's starting to form a whole nother human, so this makes you tired. Another key symptom of early pregnancy is an increase in urination. And this comes from two different sources. The first is your growing uterus, especially if you have an anteverted uterus, which about 80% of females do, meaning that your uterus tips forward. As it starts to grow, it presses on your bladder and gives you less bladder capacity, so you have to pee earlier. Also, some of the physiologic changes of pregnancy include an increase in blood volume and an increase in blood plasma, which is the more watery portion of the blood. So you end up making more urine and needing to urinate more. These changes come on very early in pregnancy and result in feeling like you got to go to the bathroom all the time. Another symptom that affects 50 to 80% of pregnant ladies is nausea. And this is certainly on a spectrum. Some people have none, the lucky ones. Some people will have a little bit of nausea. Some will have nausea that lasts all through the day. Some will have vomiting. There's a whole spectrum of what you may experience. And this kind of ties into food aversions and food cravings. Certain types of food when people are pregnant will cause them to feel ill immediately, and they can't eat it, they can't smell it, they can't look at it. That's very common for early pregnancy as well. Another common symptom of early pregnancy is bloating and constipation. And this is also due to our dear friend progesterone, which is very important to maintain in pregnancy and is the hormone of pregnancy along with estrogen, but it can give us some bothersome side effects. Progesterone's effect on the GI tract has multiple results. So one is that it loosens the sphincter that holds your acid and your stomach contents in. So that loose sphincter is what can result in some of that acid reflux, which some people will perceive as a heartburn, a pain in the chest, but some people will perceive that as nausea. So that can also contribute to nausea. Progesterone also slows the motility of the GI tract, so things don't move through as quickly. This can result in nausea. It can also result in bloating and in constipation, which does bother a lot of people in early pregnancy. Another common symptom is dizziness in early pregnancy, and this is also a relation to those physiologic changes changes in blood volume that come on pretty quickly. So feeling a bit dizzy, lightheaded. This is often resolved with sitting, staying really well hydrated, putting your feet up, but this can come on kind of out of the blue, or if you've been standing for a long time or standing with your knees locked, a sudden change in drop in blood pressure can result in that dizziness. And of course, the symptom that definitely relates to pregnancy and not your period is a missed period. So if you are having these symptoms, you are due for a period and you haven't had one, you might be pregnant. And so, of course, the way we would suggest you try to figure this out is go ahead and take a pregnancy test. Now, some pregnancy tests over the counter are sensitive enough that they can start to detect a pregnancy hormone as soon as about 5 days before your missed period or about 9 days after ovulation. If this is positive, call your OBGYN and make a confirmation of pregnancy appointment. So those are some symptoms in early pregnancy and some symptoms that seem similar either for an impending period or an early pregnancy. For more information on nausea in pregnancy and on bleeding and spotting in the first trimester, check out my channel for some other videos. Otherwise, we'll see you next time.